It was many years back, one summer, it was very, very hot summer, the March. I was having a long journey of 9 months. I really enjoyed this 9 months journey. Then suddenly, that day I felt little cool. Why? Because there was a heavy rain one day before. In the west coast of India, there was a lot of wind was coming and I was really enjoying. Then suddenly there was a push. Hum! Then I came out in this world. That was the day I was born. And then I went to many, many roller coasters in the life. One instant I know very sure, only one thing can happen in the life, that is our death. But you don't have to worry actually. You don't have to think you die of that. Why? Now we have got a lot of medical technology to save you. You can decide where you would like to go in your life. You can create your destiny and how you want to live. Today's all the talk is there to give your tools to you to get your best life. Every 18 minutes, this talk may take 18 minutes, thousands of people average get diagnosed with cancer. You know what happened to here? Many people get diagnosed in the end stage because they're already living with the disease for more than 5 to 20 years. Then when you move from the beginning to the end, then survival rate will come down drastically. Also, 80% of our cost of this disease spent on the 80% of the last stage. So it is not the way we treat the people, but is a timing. The medicine has been built for helping the doctor and how to manage the system, but not to take care of the patient fully. This is because normally we feel sick first. By the time we lost maybe 5 to 20 years of our diagnostic part, then you meet an expert. For meeting a best expert, it may be taking few days, maybe few months. Some of the countries, it could be a year also. Then we get treated. By the time we are in the last stage where we may not be able to save people, it is not because of the treatment is failing. It is because our timing is failing. Do you all know where is the best fire system in the world and where is the best fire department in the world? It is in the hospitals because they are getting somebody's coming with a fire and they are trying to treat. And last 200 years of medical evolution, still we do not have one thing, that is a smoke alarm. We fail to create a smoke alarm. It is not the treatment, it is the timing of the treatment. I feel very sad where I would like to share my personal story to you. I had an uncle who was everything to our family. He was a great teacher, he was a great mentor, and he was trying to empower everyone in the next generation to reach the best goal in the life. But outside, he felt very, very happy and healthy. He was taking care of his diet, he was sleeping well, he was helping the entire community. But one Saturday morning, early morning, he felt some abdominal pain and he just fall down. Then we rushed him to the hospital. We tried to save him. We did everything for him, but we could not save him. He lived only a few days, then he passed away. That was the day I got a shock in my life. He was feeling healthy, but why did he die actually in the uncertain moment of our life without giving his best part in his life? As a biomedical engineer working in this field, I felt that this is a time to change the technology, the way we are looking at the healthcare system in the world. Currently, I'm very happy we have got a smoking system to identify. Now we have got the technology to change the world. Why? Our body is giving lot of signal we can pick up. Then we can take it to the detection to save the life and give a treatment. The body breaks down, but not normal way. It always gives a signal. It gives it to, it could be a cardiac signal, which comes from the heart. We can predict with through arrhythmias and heart rate, saying that when it can trigger any heart failure. By just taking a drop of blood, we can say what is happening in the body regarding the cancer before any scan can identify. By studying the mitochondria and other DNA part, the scientists can predict what is going to happen another 5 years or 10 years. This is a smoking tool we have to decide and intervene before anything happens. Why this matters? When we can capture anything in the stage 1 of cancer, the survival rate is 98%. When you move to stage 2, stage 3, and stage 4, this 98% drops down to 27%. Then what happens? If you have caught in 98% of time, the first stage, the person is getting a great life. He can see his grandchildren growing up. He can enjoy their life. The treatment is very simple. But when it moves to the last stage, the treatment becomes very, very tough. Then lot of uncertainty, what is going to happen? Lot of money put in here. Many families' finances ruined because of this medical cost. So this smoking alarm will give you a right time alarm before anything happens. So when we add this extra life this by using this technology, then what happens? We are not thinking that the person can live 95 or 100 years, but we are saying that he can live with a very, very happy life. It is not the quantity of life, but the quality of life we get, the way we make happy. That is all not interesting, all of us. We think that the death may not come now, but even though after 90 years, if you get a very, very living life where you can do anything without any fear, this won't be a great thing because the system is going to identify and trigger you and take actions. But if you want the system to work, then we need to democratize these preventive measures. If only this technology can be used by the rich, what happens? Then we are creating a two-tier society. Then it fails again. So we have to democratize it. Second thing is that people who are sitting here, every one of us generate a lot of biological data. But how many people are using it for our own health? I don't think many of us are using it. Then we have an internal feeling. When you age, we are going to decline. That is our mindset. When we age, we can reverse it actually. We can really enjoy it much better. We get a lot of energy if you do the right things. So, if you want to conclude everything, what action to be taken, it is basically the leading cause of death is not cancer. It is not cardiovascular system. It is not the aging. Then what? It is to find that we are too late in the system to identify it. So if you want to save the life, try to identify, try to pick the things well before you reach your last stage. This will change the life, this will change the humanity, this will change the next generation. The way we can do is detect early. Thank you.